And on Good Morning Nigeria, today we shall discuss health issues during the Harmattan season.
Well, are you feeling it already?
Yes, I am.
What are you feeling?
It's a bit cold. The skin is dry, whitish and stuff. Yeah.
Well, that's the Harmattan, and it is one season that Nigerians never ignore. It announces itself loudly with dusty skies, dry air, and those sharp cold mornings that catch you off guard.
Beyond the discomfort, this weather quietly affects people's health. That's what you need to take note of, from dry skin, like I mentioned, cracked lips, cracked heels, to persistent coughs and breathing difficulties.
Now, what many people don't realize is that Harmattan isn't just an inconvenience. It places real stress on the body, especially the lungs, eyes, and immune system, making people more vulnerable to infections if they're not careful.
Yes, Victor, and that's why awareness is so important at this time of the year. The dust-laden winds reduce air quality, triggering asthma attacks, catarrh, eye irritation, and even nosebleeds, particularly in children and the elderly.
Now, dehydration is another silent issue because the weather feels cool. People often forget to drink enough water. Simple habits like staying hydrated, moisturizing the skin, protecting the eyes, and limiting exposure to dust can make a significant difference in how the body copes during the season.
Of course, we must add frequent hand washing. It's key, for every season, and also the Harmattan. Ultimately, Harmattan calls for intentional self-care and responsibility, both at home and outdoors.
Now, experts also advise that we wear protective clothing, practice good hygiene, and seek medical attention early when symptoms persist.
Well, some have said they enjoy other aspects of this season, though the issues mentioned affect, how many others perceive the season.
We have some experts joining us shortly to speak to the issues as Nigerians step into another Harmattan season. Now, this is our focus on Good Morning Nigeria this beautiful Friday. I'm Victor, as a welcome to the program.
And I'm Henry John. I joined Victor to welcome you to this very interesting edition of the program Good Morning Nigeria, reaching you live on the network service of the NTA. In the course of the program, we'll bring you news, paper review, and that's when Chukwudi Abuja joins us on set. He's already in the building, and of course, we can feel the heat already.
The troublemaker.
No, is he a troublemaker? I don't quite agree.
From where I sit.
I just think that, Chukwudi is always fun to be with, and of course, we're looking forward to having him with us shortly. But for now,
Right, you're still watching Good Morning Nigeria on the network service of the NTA. To begin our conversation on health issues during the Harmattan, here's a background report put together by correspondent Ibrahim Belogunda.
Harmattan is characterized by dry, dusty winds blowing from the Sahara, bringing cool mornings, harsh winds, and dusty air. While the season has its own unique appeal, it also presents several health challenges. Common health effects include dry skin and lips, cracked heels, irritated or red eyes, nosebleeds, and respiratory problems such as cough, catarrh, asthma, bronchitis, and flu-like symptoms caused by low humidity and airborne dust. Harmattan can also trigger joint pains, worsen sickle cell crisis, and increase the risk of cardiovascular complications. Although many people enjoy cooler weather, the season often comes with dehydration, respiratory discomfort, skin problems, and a higher susceptibility to infections, affecting individuals in different ways. Preventive measures such as staying well hydrated, using moisturizer, wearing face masks, and properly managing pre-existing health conditions are essential during this period. How can people avoid common Harmattan-related illnesses? What steps can be taken to help protect respiratory health? And how can those affected by weather changes effectively manage their conditions? This and more will form the focus of discussion on Good Morning Nigeria as our guest join us in the studio for an engaging and insightful conversation.
Many thanks, Ibrahim Gunda, for that background report. Now, time to get into the conversation on health issues during Harmattan. And seated with us right here in the studio is Dr. Isaac Akuma Abuja, a public health specialist. Many thanks for joining us, sir.
Thank you very much. Good morning.
All right. Let's begin. The Harmattan comes every year. Why does it seem that every year we still have to talk about it? It catches us unprepared. Or is it something that is bound to happen?
Well, I don't think it catches us unprepared. I think that it is that we are a little bit negligent in terms of how we handle ourselves and our health during this period. I don't think there's anybody that would say he or she doesn't know that from November up to March that the weather would change and that Harmattan would set in. We will be discussing on what to do and how to do, but the problem is this. Generally, people don't pay enough attention to health issues. They should do more.
Talking about paying attention to health issues, where should we be focusing on this period?
Okay. One of the things that we experience this time is cough. Cough is very common. Catarrh is very common. Cold is very common. Of course, everybody knows that your skin will be dry. Your lips will be dry. People who do night duty are exposed to extreme cold, especially in the northern part of the country. In the morning, those who must have to take bath early in the morning have problem. And I want to talk about this because there are people who take risks by taking bath with very cold water in the morning. It is not safe. If you can, warm the water so that it is not too cold for you. Let me talk about those.
What's the risk of using cold water?
It can provoke a lot of problems, respiratory problems.
Some of us grew up...
Cardiovascular problems.
Some of us grew up not bathing hot water, so I find it strange.
There's a difference between cold water and very cold water. I'm talking of very cold water. There's nothing wrong with bathing with cold water. Normal room temperature, a little bit below, but very cold water is not good for you. It will affect your breathing, it will affect your heart, or it can, and it's not good for you. So especially those in extreme age groups, the babies and the elderly.
Okay, yeah, absolutely. So do we consider the Harmattan just an inconvenience or a serious health issue?
No, it could be a serious health issue. For people who are asthmatic, for example, people who are prone to pneumonia, bronchitis, heart problems, this is not a good time for them. So we shouldn't take it lightly. And sometimes the pneumonia you get is because of the exposure that you expose yourself to extreme cold. The air comes very cold, sometimes dusty, dirty, and you inhale all of it. There's no filter. But we can do something about that. We can wear face mask that will filter the air and keep whatever bacteria or virus that is associated with the dust out of reach to our bodies.
Okay, I want you to speak a little bit more about the dust. Away from breathing, are there other ways that, the dust associated with this season can cause, health hazards for people?
It's largely through the breathing process. Okay, let me explain this. When the air is dusty, it means that it can carry virus, it can carry bacteria. Either way, both of them can affect our health. And when you talk of pneumonia, for example, what is pneumonia? Pneumonia is an infection that is caused by the air that we breathe.
What about by, contact with food, consuming food?
Yes. I will come to this. You've hit a very good point. Contact with foods. Now, if you take food, any type of food, especially fruits, which I would like to talk about, please wash them. Wash them very well. Because the dust that accumulates on any surface accumulates also on foods. And if you eat food that is not fruits in particular, that is not washed, you are taking a risk, and it's not good for you. People should be washing their hands more frequently at this time than usual. And if you see somebody sneezing, has cold, coughing, and around you, make sure that one, that person is kept clean, especially babies and the elderly. Two, whatever surfaces they are touching and rubbing their hands on should be cleaned with disinfectants. Otherwise, those of you who are near that person will be infected. But generally, at this time of the year, it is advisable to wash hands as frequently as possible. Generally, we should, but more at this time of the year.
Okay, just to let our viewers know that they can be part of this conversation by sending a message, SMS or WhatsApp messages to the number on the screen. I would, read your comments or questions, so, whatever it is as it concerns this topic. Dr. Abuja, you've spoken about dust. I want you to speak about dehydration. It's dry, like you mentioned, the skin is dry. A lot of things are cracking in our bodies. So, when we're trying to hydrate, what exactly should we be doing?
Drinking plenty water. Like I said, we're going to talk about more things that we should be doing at this time of the year. The weather is hot. The air is dry. The probability that you'll be losing a lot of water from your body is very high. Sometimes because of the high temperature, you are perspiring, you are sweating, and therefore you should drink more water to replace whatever it is that you are losing. Very important.
It's just water. Some people prefer to take soft drinks and all.
Yes, I'm coming. You can also, no, not soft drinks. You can drink tea, especially green tea. It's very good for you. But I'm not advising you to go for things like coffee. But you can drink tea. That's good for you. You can eat a lot of fruits. This is the time for watermelon, which is very good for your health. It has a lot of water, so it will replace the fluid that you are losing through perspiration. Okay, there are other fruits, apples, bananas, pineapple, whatever fruits you can find at this time of the year, please eat. But check that you are not allergic to a particular type. Some people are allergic to certain fruits. If you find that you eat a fruit and you have head problem, you have itching or skin rash or coughing or something, please check it out and probably stop that one and eat something else.
Do you think the allergy is as a result of the fruit or as a result of how it was processed before consumed?
No, yes.
People
Both.
prefer to buy cut stuff and all.
Both. There are some people that are allergic to certain fruits. I know of people who are allergic to pineapple. If they eat pineapple, they break out. They itch, and their skin becomes very red. There are people who are also allergic to, I don't know what you call it in the African apple. You know the one I'm talking about? The African apple. Some people don't eat it. If they do, they break out. But generally, there are people who are allergic to certain things that other people are not allergic to. And yes, the process by which the food is consumed is also important. If you don't wash the food, for example, and you eat it, the fruit, and you eat it, and it carries dust, which carries bacteria or virus, you are ingesting something that could cause infection. So the allergy is not necessarily, the allergy is not as a result of the process necessarily. It's as a result of your own reaction to that particular fruit. Like I gave the example of pineapple. There are people who cannot eat pineapple. There are people who cannot eat fish. Because as soon as they eat fish, they break. So, different people have different health problems. And our bodies are sensitive to different things at different times of the year too. And it is also important, talking about dehydration, let me talk more about it. This is a time when not only should we drink plenty water, we should make sure that we'll control our activities. During the heat of the day, especially between 12 noon and 4 p.m., it is risky for you to go and do exercise. It is risky for you to go and be walking in the sun or be running in the sun. It is advisable for you to do your exercise early in the morning, before noon, and later towards evening when the sun is a little mild, from 4 o'clock, 5 o'clock down. But when it is very hot, it is not advisable for you to go running, go walking, because you lose more water.
What about those who don't have a choice? Those who push wheelbarrows in the market,
Good
for
question.
example.
If you don't have a choice, do it in your house. Do it under the shade of a tree. But don't go into an exposed
But there are some jobs
open
that
area.
require you to stay under the sun. Imagine a mason, for example.
Yeah,
He's not probably going to be
yeah.
laying blocks under a shade.
No, I like that good example. That's a very good example. There are people who are on top of the roof during the day, and they are exposed to dust. They are losing a lot of water by perspiration, and a lot of salt from their bodies too. These people should drink plenty water. Constantly drink water so that you'll be rehydrated. They should also periodically stop whatever they are doing on top of the roof, come down, rest a little bit before you go back. Don't continue walking and be exposed to that extreme heat for hours. Even if it looks like you don't have any problem, you might come down with problem eventually.
Now, what are the implications of the Harmattan on community health? Say in a city, an urban city like Abuja, for instance.
You recall that during this time of the year, we used to have what we call Apollo. Somehow I haven't seen much of it this year yet. Once somebody in your household has Apollo, the probability that somebody else would have is very high. It spreads around because of what I talked about earlier, touching and contaminating our hands and so on and so forth. Burning of bushes. Although in Abuja we are not exposed to that because there are no bushes around us to burn. But if for any reason you have something around where you live that you need to burn, please do it in late evening.
Okay.
And stay away from the smoke that comes. In the villages, people cook with firewood.
Yeah.
And sometimes with shrubs. And that produces smoke. And it could cause irritation and respiratory problem. So people should stay away from that. In a place like Abuja, where you have a lot of people, if somebody has cold, catarrh, runny nose, and so on, the probability that that person could also affect another person who is around him or her is high. If I have a cold and I have runny nose and I'm touching my nose and I shake hands with you, you carry it and you also rub it on yourself, you will get it. So, and this is also one of the reasons why I advise that you wash your hands as frequently as possible. You cannot avoid shaking hands with people because it's part of our culture. You cannot always stay away from people. Sometimes it's not possible. Sometimes it's not even advisable because culturally, if you go to somebody's house and you stay in a way that gives some signal that you are avoiding them, they will ask you questions. Unless you see that person coughing, sneezing, and you say, okay, well, let me stay a little bit away from you, that's acceptable. But if it is not that obvious, and you go to somebody's house and you stay away from the person, they will question you because it's not socially acceptable.
Now you've talked about water, green tea as acceptable fluids. What about taking cold drinks? You've also spoken against the carbonated drinks. What about processed homemade drinks, zobo, soy milk, and the rest of them?
Very good. Zobo is good for you. Fruit juices are good for you. Kunu, well-made kunu is good for you as long as it's not contaminated. My worry sometimes is that the ones we see on the streets and we buy, you don't know the source of water that is used and how the containers that they store them in are washed. You make kunu, do kunu very well. If there is anything, bacteria, it may have been killed by the heat. But how about the storage? That's a concern. But all fluids that are things from juice, fruit juice, homemade juice, pineapple juice, for example, melon, watermelon juice, kunu, are very good for you. Carbonated drinks are not advisable unless you have no choice. If you don't have a choice and you are dehydrating, go ahead and take, but not alcohol. Please don't take alcohol as a remedy for rehydration.
Okay. Speak about people who already have certain health conditions that should be extremely careful this period. And then speak about self-medicating. I think I've met a number of people who probably take vitamin C during a certain period. They tell you, well, it just helps them stay away from whatever it is that is flying around and all of that. Or some people who just take antibiotics because, a neighbor has, a cough and they're taking antibiotics in their own houses. Speak about that.
That's a very good question. Self-medication is not advisable, especially people who go to the pharmacy, to the chemists and ask for antibiotics. Antibiotics should not be taken randomly and irresponsibly. You should take antibiotic only when it is prescribed by a health worker. Don't go and take antibiotic because you think you need it. It's not good for you. Now, if you have any health problem, please go to the nearest health facility where you can get help. Now, let me talk about this coughing issue. Even though this time of the year is when a lot of people are coughing, if your cough lasts up to 2 weeks or more, please go to the nearest health center for a checkup. Check it out. It may not just be ordinary cough. It could be TB. It could be something more serious. Prolonged cough is an indication of a serious or underlying problem. So don't take it lightly. If you are coughing continuously for more than a few days, please go to the health center. Now, vitamin C. There's nothing wrong with taking a little bit of vitamin C for a few days, not more than a week. But do not take antibiotics for even a day without prescription. It is not good for you. It can do a lot of harm to your body, and the consequences are more than the benefits that you think you would get. And by the way, it is not every cough that is infected. So why are you taking antibiotics? And sometimes the health problems we get at this time of the year are caused by virus, not even by bacteria. And antibiotics don't kill virus. So you're wasting your money, you're wasting your time, and you are causing a health problem for yourself.
So speak about those with already with medical conditions that should be extremely careful.
Yeah. People who have especially respiratory problems like asthma, they should be very careful. They should go out only when they have to. Let them stay indoors as much as possible. Stay away from dust. Stay away from direct wind. Stay away from wild animals, dogs, cats, horses, camel. Their heights provoke asthma attack. Keep your medication near you. Very important. Because you may have an attack during the night or at some time when your medication is not near you. If you have an inhaler, go around with it, always in your pocket or in your bag. And if you don't have one, get one. If you are asthmatic and you don't have your drug with you, you don't have your inhaler with you, and you get an attack, say in the market, and there's nothing for you, the probability that you will die is very high. So do that. If you have bronchitis, if you have pneumonia, any of these respiratory problems, or if you have a heart problem that is diagnosed, be very careful at this time of the year. And please adhere to the instruction of the health worker, the doctor. Whatever he tells you to do, please do it carefully. Whatever drugs he tells you to take, please take it carefully and adhere to the instructions given.
All right. Dr. Abuja, thank you. Thank you very much. Let's now make welcome here in the studio Dr. Ahmed Sani Bala. He is of the Department of Family Medicine at the FMC here in Abuja, and he's also CEO Vital Aid Medical Foundation here in Abuja. Thank you very much for coming on the program.
Thank you very much for having me.
Now, we've been discussing the Harmattan and the associated health risks or challenges that come with it. What complaints are mostly common in clinics during this season? And do we have any statistics of an increase?
Okay, as you know, Harmattan is a season that comes with a little bit of stress on people, generally because of the harshness of the weather. It's mostly associated with cold, dry air that's harsh on people. So as a family physician, we, at the general outpatient clinic where patients come in from, that's the first contact with the patient, we see families because of the environmental conditions. So most people are exposed to the same things at the same time. So most of the time you see more than one or two of the family members coming in here. So as regards to the statistics, yet I've not come up with statistics from my facility about the increase, but definitely there is an increase in some particular diseases and conditions as opposed to other seasons of the year. So example, like people tend to come down with upper respiratory tract infections. Presentations ranges from cough, catarrh, runny nose, and then sore throat as they present with it. And then other systems are affected also. They come with itchy eyes, they come with red eyes. Then in other conditions also, more serious conditions, like people with airway sensitivity. So they come with asthma attack, exacerbations of asthma, worsening of their asthma attacks because of the season, and also some of them with other chronic diseases that are a little bit more serious than asthma. We call it chronic obstructive respiratory diseases, especially the elderly. They come with worsening of the symptoms also with the coming of the Harmattan. So there is a higher interrelation between this season and the exacerbation, and then the coming down with some diseases with different severity, from mild, moderate in some cases to severe diseases.
What about children? What is the concern for children?
Yes, the concern for children, especially preschool and school children, the parents mostly bring them in. You see like 2 to 3 children at a go brought in by the mother or father. And doctor, since this cold started, the children are coming down with so much cough, so much catarrh. Some, they will come with high fever. That he has been having sore throat, refusing to eat and all that. I don't know what's happening. So all these things are attributable to this Harmattan season, the upper respiratory tract infection that we see. And each age group has what is a little bit predominant in their presentation.
I want you to speak about conditions in our homes that could worsen these health conditions during the Harmattan season.
Okay.
Dr. Abuja already talked about dust and all, but that's like mostly when you're outside. But indoors, what are people supposed to do in their houses this period that would help them stay healthy?
Okay, there are things to avoid and then there are things to do. So for the things to avoid now, the Harmattan, as I said earlier on, the air is dry, and then the dryness of the air now makes the respiratory system to be more susceptible to things that like infections and all that, because it cracks and then it irritates the respiratory system, the skin, the eyes, making it more susceptible to infections and all that. So the weather itself is predisposing these systems to infections and irritation. So some of the practices we do at home also unknowingly, they tend to worsen that predisposition. Examples like in places with high, with extreme of Harmattan conditions like Jos, it gets extremely cold. Abuja, in some areas, it gets extremely cold and then the air gets extremely dry. So people tend to bring in heating systems. Example, like they will bring charcoal to try to warm up the environment and all that. So this charcoal on its own, it releases smoke. And if airway is already sensitized and then irritated by the weather itself, then bringing an extra smoke that is being emanated from the charcoal can further dry and irritate the airway. It can irritate the eyes, and then it can also, if care is not taken, with the amount of carbon monoxide, it can lead to carbon monoxide poisoning, which are among the things that we see as complications sequel to people trying to find their way around the Harmattan season. So we try as much as possible to prevent taking in charcoal into a room that is enclosed without any ventilation as much as possible. Then people tend to also use different kind of things to warm up the place. So it ends up like drying the air, making it less, reducing the humidity of the air, making it more dry, and then it further worsens the symptoms. So as much as possible, as we want to heat up the place, we should use heaters that have humidifiers to make the air humid, so that to reduce the dryness of the air and then the effect of the dry air on the various systems that I mentioned earlier on. And as much as possible also, other things that irritate people with asthma, like allergens and allergic reactions on a normal day, it's worsened now during this Harmattan. So I will still call on for people to, as much as possible, keep away from all those other things, much especially during this Harmattan. Like dust, if you are sweeping, at least if you don't have a vacuum extractor and all that, you can wet the place very well to dampen the dust that will be that will be arising during the sweeping. So as much as possible, sweeping the outside the environment. If there are like workers, sweepers in our settings, our homes and all that, they can be provided with protective equipment like face masks, so that they will be able to sweep without getting too much exposure to allergens. And then as much as possible, they should wet the place and dampen the air to prevent the dust from rising. Then during cooking also, they should open the windows for cross ventilation at homes, our mothers, our wives, so that the smoke and fumes that comes in from there should have an escape route, and then would not further worsen, compounded by the Harmattan season, further worsen the system of the respiratory tract infections and irritations that they are having.
And it looks like this is a season to wash and clean.
Yes, because of the dust
frequently.
frequently, because you sweep a place before you turn, it's also dusty again. And then as much as possible, even as much as we can advocate for cross ventilation and all that, we should have protective linings in the house to prevent the dust directly from entering the houses while we maintain ventilation.
All right, thank you very much. Let's now introduce, I understand that our guest in our Kano studio has joined us. So let me introduce Dr. Hassana Abubakar Imam, who is a consultant pulmonologist at the Aminu Kano Teaching Hospital. Thank you for coming on Good Morning Nigeria.
Thank you for having me.
All right, let's get to you quickly. Now, the Harmattan has a lot to do with, of course, the respiratory system. So how serious can it be for the lungs, particularly when it comes with certain people, as Dr. Abuja had explained earlier?
So as it has rightly, the season comes with air that's cold, dry, and dusty. So, ordinarily for survival, we breathe in and the airway, is sort of exposed to, the environment. So the lungs is important in that we breathe, filtering dust, particles, other particles, and including germs. So when we have a season, when we have to breathe in a it's dusty and cold, it could impact the airway in certain ways. So the dust could irritate the airway. Cold nature, could narrow the airway, and then, all this could lead to processes in the lungs that could impair of the lungs or airway from actually filtering such dust particles or germs. So those are usually prone to respiratory disease or lung conditions during Harmattan. Those that, as has rightly been said, the elderly and the young, because the young, it's considered that their immune system is not well developed, while the elderly, the immune system is weaker. Then those that have, conditions, health conditions, system to be weak. Those that have existing lung conditions, they already have lung injuries, so a little insult could exacerbate their condition, and then what we call chronic obstructive pulmonary disease. And then those that generally have chronic conditions, so like heart disease, liver disease, kidney disease. So their immune system too is not that deal with the harsh weather. So basically, all Harmattan, what comes into play to cause disease or respiratory conditions is that the dusty, dry nature could irritate the airway and, incite what we call inflammation. That's the body's, ability to try to, fight such, insults to the airway. So this inflammation, makes one prone to, having infection. Secondly, allergies. So allergies from dust, there are certain things in dust. Dust itself can irritate, and then there are, what we call dust mites too in dust that could, trigger allergic conditions, particularly asthma in those that are, prone. Then infective process, so I've talked about irritation from dust, I've talked about allergies, then infective process. So I'd like to seize this opportunity to actually, explain that it's not the cold that causes respiratory infections. There are germs that cause that. They could either be bacterial or viral. So what happens is that these germs, they thrive in such conditions, cold and dry conditions. That means they survive better. Secondly, when the cold air, passes through the airway to the lungs, it makes it dry, it irritates it, it causes a lot of inflammation. What happens is that it makes these germs, enter the body easily and cause disease. So when you're talking about the germs now, getting into the body and your immune system is not able to fight that, you come down with certain diseases. So, and then again, during cold season, we tend to, stay indoors with the windows and doors closed, to warm the environment. So we tend to cluster together. So what happens is that when one person has such respiratory, infection, he's prone to sneeze or cough out, germs in the air. He's prone to, rubbing, or coughing or sneezing, in the palm, and then he could spread those germs on surfaces, on doorknobs or handshake, okay? So clustering together during cold season, propagates this infection. So having talked about irritation, allergies, and, irritation. Now, what the kind of conditions that can affect the lungs during Harmattan is one, exacerbation of pre-existing lung conditions. You could have a chronic lung condition from some other afflictions, and because of the nature of the harsh weather causing irritation, further injury, and getting one more prone to infection, so your pre-existing lung condition could get exacerbated, meaning it could get you could have, should I say, an attack of your pre-existing lung condition, whatever it is. Then you could have asthmatics and those with chronic obstructive pulmonary diseases could have, frequent attacks from allergy, from irritation from dust, from, the airway being prone to narrowing from the cold nature of, the environment. Then we have frequent pneumonias. Pneumonia could be bacterial, it could be viral. So in a nutshell, these are what one can come down with. So symptoms would include, cough, production of sputum, there could be blood in sputum, you could have, chest pain on breathing, you could have fast breathing, you could have fever, body pains, anorexia, what's it called? Poor appetite. You could have all that. So, so basically, in a nutshell, that's how Harmattan can affect the lungs.
Dr. Hassana Imam, great points you have made. But I'd like you to speak on the health conditions that are common in the northern part of the region this season. Is meningitis a concern this period? And then speak about what can likely boost immunity, because, the dust is there. There's really, you can do all of these steps recommended by the doctors, but of course, you still get in contact with a bit of the dust and, like Dr. Abuja said, meet other people and all of that. So how can you, improve your immunity just so that you do not come down with some of these ailments that are common this period? Are there foods that we can eat? Are there medications that should be taken? Is there immunization for children this period? Speak about that.
So, talking about diseases generally, there are modes of acquiring diseases. So generally, diseases are acquired from, inhaling of germs through the air, which is more prevalent during this season. You could have, spiking or increase in such conditions during that period. So yes, meningitis, is something, even though, you have Harmattan from, say, November to March, but then meningitis, is towards the ending period where it's when the time is the temperature, is more, warmer than, at the beginning of the Harmattan. So yes, you could have, meningitis at this period. Not just that, not just because of the way that it's been acquired from inhalation of germs in the air, clustering also and lack of ventilation, just as you would have during Harmattan, could propagate the spread of such disease. And then talking about how to boost the immune system. So there's, it's one thing for the germs to get into your body, and then it's another for your body to be able to fight it such that you don't come down with the disease. So in as much as we try to see that, we take measures to prevent us from acquiring such diseases, we also need to boost our immune system. So in boosting our immune system, basically you like to avoid stress, try as much as possible to have adequate rest, sleep. Adults, the recommendation is for adults to have 8 to 9 hours of sleep at night. Then, you take food, particularly fruits and vegetables that contain micronutrients that, would help. And then basically you take, a balanced diet to be able to build, not just your immune system, but other systems, that work hand in hand with the immune system. So yes, you take fruits and vegetables and you take a balanced diet. So aside from that, you could also protect your immune system by having vaccinations. So those that have been recommended to take vaccines are the young. As I said, the young have, kind of a weaker immune system, so it needs to be boosted. Then, those adults that have chronic lung disease, they already have a condition, so you like to protect them from having, infections, okay, more insults. So you like to vaccinate them. Then not just that, those with, chronic kidney disease, diabetes and all that, the immune system is, kind of, weak. So you like to boost the immune system by vaccinating them. So aside from that, boosting the immunity, you will also like to protect yourself from inhaling such germs or protect your airway from getting dry and irritated. So you could take a lot of water, to moisten the airway. You could use face masks when, going out, particularly when it's quite dusty, and then try as much as possible to avoid pollution. So another category of people that are prone to, lung conditions during Harmattan are those that have pre-existing lung disease from, long-term exposure to environmental dust, or occupational exposure. So for them, regardless of whether, it's Harmattan period or not, you'd like to advise them to always have their face mask, try as much as possible to avoid pollution, use face masks as much as possible, just to limit, the effect of the harsh, dry or dusty or, effect in addition to environmental pollution, affecting the lungs. So, yes, so I'll say basically that's it to, try to boost the immune system and, try to prevent such conditions during Harmattan.
Thank you, Dr. Iman, for that elaborate explanation. Now, back here in the studio, Dr. Abuja, does the Harmattan require a change in diet necessarily?
I would say yes to that. This is the time when you must eat more fruits, especially fruits that contain vitamin C.
Which are?
Which are apple, strawberry, banana, watermelon. Doesn't really have
Oranges?
vitamins. Orange, number one. Number one is oranges, tangerines. All of them are very good. If you make tea, You could cut lemon, not lime, lemon, and squeeze some of it into your tea. Lemon contains a lot of vitamin C and it's very good for you.
Does a lot of it have side effects? Lemon?
Yes. If you have ulcer, for example, you must not take too much lemon because it will irritate your system. But if not, there's just taking one lemon, washing it, cutting it and squeezing it into your tea will not cause any problem. And especially when you combine it with green tea, very good. Take a lot of oranges, a lot of tangerine, lemon in your tea, lemon in your food. You could make salad and squeeze lemon on it. If you prepare fish, you can squeeze lemon on it. It's very good for you.
Now let's talk about other aspects of the body besides, our health. One part that would mostly neglect this Harmattan is the skin. Are there things that we can do, really, to protect our skin, from the harshness of the season? And then, is there a long-term effect from not protecting your skin during Harmattan?
Thank you very much. So the skin, as we know, it's exposed to environmental conditions. So protecting the skin during Harmattan is very paramount because the air changes and it gets dry. And then the air is drier, so the water loss from the skin becomes the barrier. The skin is a barrier that prevents water loss and all that. So when the humidity in the air is very, very low, more water escapes, making the skin very, very dry and cracky. So it cracks over time and then it becomes irritated. So what that leads to is that if there are other underlying skin conditions, there might be flare during this period, right? So how to protect our skin is by ensuring that we use protective clothing that would cover the skin and prevent it from these adverse environmental conditions. And then also we can use particular creams and emulsifiers on our skins in order to keep it moist, in order to trap the moisture and avoid excessive dryness of the skin, that the long-term effect now that could lead to what people generally term as eczema from irritation of the skin and all that. So by keeping the skin very, very moist and then avoiding excessive exposure to these harsh environmental conditions, I think it will go a long way in preventing the effect of the Harmattan on the skin.
All right, and you've talked about, Dr. Abuja, you've talked about exercise earlier, that people should, do it in weather conditions that are more kind to the body. But should it be increased this period or should it be less just because of the Harmattan?
No, you don't have to do extra exercise because of the Harmattan. But exercise generally is good for you. And since you need to exercise generally, that's why we advise that you do it when the weather is cool in the morning hours, up to 12 noon, depending on where you are in the country.
Or indoors?
Or indoors, or when the weather is cool towards evening time, 4 o'clock, 5 o'clock to 6 o'clock. And I also recommended that you could do it in the shade, in your house.
Yeah.
You don't necessarily have to go
out
to do exercise. You can walk around your house if that's your limitation. You can walk around your house to increase blood circulation. So you don't have to do vigorous exercise. And the exercise is not necessarily because of...
okay, but through all of this, how important is indoor health quality, whether at home or at work?
Yes. I need to repeat this too. Very important. That's a very good question. Now, we've talked about cooking indoors with smoke. If you are cooking, please open your windows. In the same way, when you are sleeping at night, when you are not cooking, when there's no smoke emanating from your cooking or your stove or whatever in the house, please close your windows and doors.
Oh, really? At night?
Yes, at night.
So how do you get air?
Well, if you must have to leave them open, I'm talking of people in the village.
Okay.
Because that's where the problem is experienced most. If you see houses in the villages, most of the houses are very small, and some of them have only one
window
or no window. Some have one window and a door. it is not advisable to close both the door and the window. Instead, get a screen. Put the screen on the window and close the door. Or if you must leave the two of them open, please put a screen. Don't let that very cold, dusty air come directly on you in the night. Think of a place like Jos. Think of a place like Kanu, Meduguri, when the weather is very cold in the night. It is not advisable that you take that cold air directly.
All right.
And let me, before I forget too, especially the issue of smoke. Elderly people, normally in the villages, warm themselves with firewood at night. They must have to, if they are warming themselves with firewood at night, they must have to open their windows.
Yeah, doctor mentioned that, he talked about the smoke thing, but we're about to go on a break. I'd like you to speak about women and the Harmattan. This is the period where we have a lot of women going for pedicure and all of that because of the cracked heels. Speak about that. Is it healthy to do that, continuously? And then he talked about the skin. I was actually driving to a point when I talked about the skin because for the men, you may not understand. I'm sure you use one or two products on your skin. But for women, we have different layers that we apply. So this period, should we wash often or should we continue to apply just in the bid to look beautiful? And then speak about the pedicure thing.
Yeah, before I even talk about the pedicure something, at the introduction, during the introduction, they showed a man whose feet was very cracked, seriously cracked. If you can show it again, it will be nice. We have to be careful with this kind of situation. I imagine that man is a farmer, and he is farming and harvesting his crops at this time of the year. With that serious cracks on his foot, he could get tetanus. Yeah, that's it. This is very serious. And if you have this kind of condition, it may not necessarily because of the weather. You may need to go to the hospital and check yourself. But with this kind of condition, it is not only Harmattan. If you are in the farm working and with this kind of cracked foot, it may be bleeding and you could have tetanus from this. So it's very serious. Now, talking about women with manicure, if I were a lady, I would be more careful this time of the year. You have to weigh between beauty and health, which is more important. And by the way, the overscraping of the feet and of the hand is not advisable. Why don't you just keep it clean? If you keep it clean and you rub a balm or a moisturizer, your skin will glow. It will be nice. But if you think that you must have to scrape all the outer skin, protective skin of your body so that you look very smooth, that smoothness may not be the solution to your problem. As a matter of fact, it could be the problem itself. Because when it becomes too thin, the skin becomes too thin, it will crack easily. And infections can set in. So we have to be careful.
All right. Thank you. Thank you, Dr. Abuja. There are a lot of things to consider, really. But let's pause at this point for a break. All right. Thank you for staying with us. This is still Good Morning Nigeria on the network service of the NTA. And we've been discussing the Harmattan and associated health challenges. Now, we have messages coming in from our viewers, and I'll begin by taking this one, which asks, he said the doctor talked about taking a lot of fruits, but I am diabetic. So what types of fruits should I take or avoid? I'm sure that's for Dr. Abuja, but we'll get there. This one is from Obongete James in Plateau. My question is, what should be used to flush out dust from the body? And finally, maybe the doctor in Kanu could take that. And finally, good day, doctors in the studio. Prevention is better than cure, so I advise that people should adopt knuckling instead of shaking hands directly and use nose mask this time around. That's from Native Onwuka in Makurdi. So perhaps you start by responding to the one on fruits before we get to...
Yes, it is true that some fruits have a lot of sugar. I was talking about pineapples earlier. They have a lot of sugar. banana, especially there is some special banana that has a lot of sugar. You have to be careful with those. But there are other fruits, strawberry. I talked about watermelon. Watermelon doesn't affect anybody. That if you are diabetic, you can take watermelon.
No,
but
not
let
too
me
much
caution
of it.
here. I heard, and it's not only one report, of people who have got reactions to watermelon when they are taking this multivitamin, especially these Chinese ones that they are selling all over the place.
Do you advise those multivitamins?
I wouldn't spend my money on them. I would take natural fruits, natural food. I won't waste my money on those things.
So why then do doctors prescribe them?
No. Now, be careful here. There are certain multivitamins that you can take as a result of certain health conditions. That's different. But these ones they are selling around everywhere. And one multivitamin cures everything from kidney to heart to eye problem to infertility and so on. Those are all deceits. They are not true. And I wouldn't waste my money on them. What I was trying to say is if you are taking those multivitamins, be careful with watermelon. There are some people who react to them. But it's not only one or two fruits that we have around. We have plenty of fruits around. There is this black fruit that is very common during this time of the year in villages. It has a lot of sugar. You have to be careful with it. There's another one that is tiny. It has a lot of vitamin C. You can take one or two of it and lick it. It is very sweet, and it's vitamin C. And like I said, cook a lot of vegetables, carrots, for example, greens,
Cucumbers.
and so on. Cucumber, watermelon. Fortunately now we have all varieties of watermelon. We have the yellow one, which normally grows in the desert. Now we have access to them. They are very nice. And people who are diabetic can take those.
All right.
But let me advise too, if you are diabetic, always consult your doctor or your health worker frequently. Don't just go once and then stop. Frequently. They may need to adjust your medication. They may need to adjust your diet depending on how you are responding. That's very important.
All right, many thanks, Dr. Abuja.
Yes, I wanted her to take that question.
I think we should take some more
flushing.
questions so that she can handle them at the same time, just so we can save time because we're running out of time. This one says, I'm Albert Ishaya. At this season, how do I prevent myself as an irrigation farmer? Doctor, is there any precaution substance to protect one from Harmattan dust, as Maiduguri Harmattan is always mixed with blowing air? That's Umar Babagana from Maiduguri. This one says, good morning, guests in the studio. Please, what is sinusitis? I'm not too sure about that. Sinusitis. Okay, well, what the person spelled. Does it come with headaches? That's from Femi Joel from Abuja. This one says, the doctor talked of taking lots of fruits, but I'm diabetic. What types of fruit should I avoid? That has been dealt with. He said, what about incense burning? Turare wuta, which is very common here in the north. Our women normally close the doors and windows during the burning of the incense and even stay in the room because of the sweetness of the incense. And this one says, Nandap Wiyab from Jos. For individuals with pre-existing conditions like asthma or bronchitis, what extra precautions or changes to their medication should they consider? How do we best protect food and water from dust-borne germs and microorganisms during the season? Can using humidifier indoors really help ease breathing difficulties? And what maintenance is required for these devices? Thank you for your time. This is Nandep Weya from Jos. So I think we'll just allow you to respond to some of the questions. Then, of course, we'll get to Doctor in our Kano studio.
Okay. Thank you very much, our viewers, for the question. So I would like to start responding. The person that says he's an irrigation farmer, and then so irrigation farmers, they work predominantly outdoors, but we advocate for what is called personal protective equipment. As you are doing your job, you are exposed to hazards, so you should protect yourself from such hazards. So now in this dusty condition, where there is limited water and then they tend to do more of irrigation, the machines that they do the irrigations, they exude smokes and fumes. The generators they work with, and then the open environment, they do the farms and all that. Also, there are dust. They are tilling of land, of the soil and all that. All of these produce so much dust and all. So what I advocate for is for the farmer to use personal protective equipment and clothing, in that he can use an overall clothing if it's available as much as possible, and then hand gloves, and then as much as possible use a face mask. We have face masks at our disposal, and then use goggles also to prevent the dust from entering the eyes. So by using this personal protective equipment, they would protect the farmer, the irrigation farmer, from environmental hazards that are associated with the work he does. Then I would also briefly want to address the other issue of how we protect our fruits and vegetables from getting contaminated with germs. So once we get this from the market, because from the production to the transportation, storage, and before we buy them subsequently to our homes, they are just exposed outside. So different environmental conditions, dust, people touching them in terms of pricing and all that. When you come back home, before you do everything, you wash your hands, and then first of all, you wash these fruits and vegetables. If you have salt, we all have salt in our houses, you can wash them with salt water and then rinse them very, very well. At least 3 times, rinse them very, very well before we store them in places where they are covered. If we have refrigerators, fine. If we don't have refrigerators, we can keep them in baskets and then use a layer of clothing to cover them. So if we want to use them, we can just briskly wash them again before ingesting them. In that, we reduce the bulk of germs that brought into the house and then prevent transmission of germs like that. Then I would also address the issue of burning incense. Coming from this part of the country, it's part of the culture, especially predominantly northeastern culture, of the incense, different nice smells and all that. But what we have to put into cognizance is that these are produced from sandalwood, and sandalwood, they are from the normal tree extract. So they soak them in the perfume over time, some over years, even some over months. Once it gets absorbed, different perfumes, different scents of the perfumes. Then once you are burning them, the smoke it's emanating would be very scenty, and then releasing different scents that would, let me use the word deceive in court, that you are not inhaling smoke. But burning all these things, it actually emanates smoke. And then we're inhaling the smoke disguised in the scent we are using. And mostly they said when they close the places, it absorbs very, very well. So in as much as possible, we have to weigh the options of how harmful it is to our health, and then how pleasurable we find it. But talking from the doctor's perspective, the ENT, the ear, nose, and throat specialists are actually discouraging this, because we work hand in hand with them. Being a family physician, we work hand in hand with all the other specialties. So at some point, I had the privilege of being in a rotation that took me to ENT, and then we saw many people coming down with some throat irritations and all that. So that were attributable to chronic repeated exposure to this incense, and then there are humidifiers that you put in some incense also. So repeated exposure to it can worsen conditions that children, especially in children, even adults with adenitis, and then with adenotonsillitis and all that, that irritation can worsen there is a change in the oropharynx. That there's a link between the nose, the throat, and then the airway. So irritation now, recurrent irritation from all these irritants can lead to abnormal growth of some tissues there that would be worsening the respiration and then causing obstruction in the respiration. And then in asthmatics and people with obstructive pulmonary disease. So exposure to this is like exposure to the allergens, which are smoke and other things. This one is just that the smoke is disguised in a pleasurable scent. So as much as possible, I would advise especially people with airway sensitivity and people that have that are asthmatic and they have other chronic obstructive diseases to please desist from all these fumes in terms of turarumota and then scents that they are very detrimental to the health.
All right, let's get to Dr. Nkanu.
Now, somebody particularly asked how they can flush dust from the system.
Yes, so I find this question amusing because this is the very first time I'm hearing such flushing dust out of, the body. I've heard about flushing toxins, from the blood, from the kidneys. So be it the lungs, the kidneys, the blood, basically you don't need to flush either dust or toxins. You see, the body is, God's creation. It was created, perfectly. There are defense mechanisms in the body, physical defense mechanisms, and then, I would say, what should I call it now? The other defense mechanism that has to do with, molecular, at the molecular level. So now, talking about the airway, okay? First of all, the nose has been created in such a way that there are, what we call turbinates in the nose, and then we have nasal hairs, hair in the nose. So these trap, particles as you breathe them, from the atmosphere. And again, dust particles are being measured by size. So, talking about the particulate matter, the aerodynamic diameter. So the larger dust particles are being trapped by the, hair in the nose, and then, the anatomical structure of the nose, the turbulence and all that. The finer particles now are able to, pass that and go through the lower airways, into the lungs. So aside from the nose, the lining of the airway is kept moist by mucus. That is to allow for trapping of your dust, other particles, smoke particles, germs, okay? So it's moist, it traps all this in the mucus. Then there's what we call, mucociliary escalators. Basically what they are tiny hairs that, flap upwards to push that mucus that contains all your particles upwards, such that, you cough it out as phlegm. So that's another protective mechanism. Then in the event that it gets the, lungs itself, there are cells, defense cells that, engulf them, try to digest them, okay? And, now, eliminate them. So in the event that your immune system, your defense mechanism, any of these, either anatomical or, at the cellular level or molecular level, is defective or impaired, that is when such particles, dust, and, germs will be able to cause harm, in your lungs. Now, for dust particles, the effect of dust particles, its effect could be immediate effect, it could be long-term effect. So your body, even if it's not able to digest the particles at that time, it will be able to contain it in its, defense cells, okay, to contain it for a while. So that is why, we advise that, particularly those that are prone to exposure to environmental or occupational dust, fumes, or smoke, we advise them to limit the exposure by use of...
Thanks, Dr. Imam. Because of time, thank you so much for your explanation. We need to round up the conversation now because we're completely out of time. But there was a question about sinusitis. Okay, and then there's this one that talks about being sickle cell, and what should the person do to avoid crisis this period.
Okay. So thank you very much. Because of time, I would be brief with the sinusitis. So the sinusitis in a broader description, it's inflammation of the sinuses. So this sinuses, there are spaces within the skull that their main function is, they are lined with a special tissue. So their function now is to humidify the air and warm it before it gets down to the lower respiratory tract. So in some instances, like any other part of the body, can get infected and get diseases and all that. So the sinuses also can get inflamed from conditions and they can get infected. So as the viewer asked of the question, yes, sinusitis, it can present with headaches, and then it needs a review by the especially ear, nose and throat specialist. And then this season can worsen the symptoms somebody with sinusitis has. So it's very, very paramount for the person to see the ENT specialist, especially with worsening of the symptoms of the sinusitis, nasal discharge, headaches and all that. So I would advise that the person, as much as possible, prevent exposure to dust and cold air. And then if any of these symptoms sets in, he should see the nearest ENT specialist that he sees for follow-up.
Sickle cell.
Right.
Yes, for the
30
sickle
seconds.
Okay, for the sickle cell now, as much as possible, they should avoid, because extreme of environmental conditions can trigger their crisis, both physiological and then physical stress can lead to the triggering of their crisis. So extremes of conditions like cold should be prevented. So in this particular season we are, that's Harmattan, where we have extreme cold and dust. As much as possible, they should prevent themselves, use protective clothing to prevent
All right,
cold.
thank you so much.
Thank
I'm
you
sure
very much.
Thank you. I have one last one. I hope Dr. Abuja can take 1 minute. And it says, if someone has pneumonia, how can they prevent it? Well, I don't know what that means anyway. And it's asking
Consult your doctor.
which mask is best.
No, if you have pneumonia, the best way to prevent it is warm clothing.
All right.
Dress well. Cover your chest.
Thank you very much, Doctor. We'll have to leave it at that. Of course, we hope that our viewers, if you have other health concerns, you consult your doctor and get all that you need. Many thanks, Dr. Isaac Akumai-Gboja, public health specialist. It was indeed a pleasure to have you as our guest, and thank you for always being available. This one says, did I say this one? I was about to read another message. So many messages. Dr. Ahmed Sani Bala, Department of Family Medicine, FMC Abuja, CEO, Vital Aid Medical Foundation. Thank you so much. We do appreciate you.
Thank you for having me.
Sharing your time with us. And of course, Dr. Hassana Imam, consultant pulmonologist, Aminu Kano Teaching Hospital, Kano, who joined us in our Kano studio. Thank you so much, ma'am. And of course, we hope that a lot of Nigerians would be healthy this period. So that's our package this Friday. I'm Ian Ray John.
Victor Azo.